You are an expert in this field.
I'm an infectious disease physician by training, and I've been working with the Ministry of Health for 34 years and 6 months, apparently. That's what they told me. So I've been around looking after patients at Nipah, patients with SARS, H1N1, Ebola, well, the works.
So talk us through about this particular virus, coronavirus. Tell us a bit about the properties of this virus.
Coronaviruses are respiratory viruses. Now, many of them cause very mild symptoms of URTI, or upper respiratory tract infections, that don't do us much harm until two of the more evil sisters came along, which was SARS in 2003, and in 2012 or 2011 it was the MERS-CoV. What we see of this current novel coronavirus, which we have given actual name for the virus, is actually coronavirus, SARS coronavirus 2. But the disease it's called Covid-19. It's similar in the sense as the way it spreads. There's some similarity. It is droplet spread and direct contact. There's argument now in China that some of the Chinese health authorities says it could be airborne, but that has not been established around the world. It causes respiratory infections mainly. So most times when severe cases, it will be linked to infection of the lung, which is a pneumonia. And if the pneumonia gets worse, it can also affect other organs. And of course, finally, as we know, there is a risk of death. Now, that's where it differs from SARS. In terms of infectivity, this virus is a lot more infectious than SARS, and you can see the numbers shoot up. However, the good news would be the mortality or the severe infection seems to be significantly less, but it can be explosive. Just like H1N1, it can explode very quickly, and we see this coronavirus is also exploding fairly fast, especially in China.
So as a layperson, right, because I see a lot of arguments online, people saying that, there's no need to worry, the common cold is more dangerous. So why are we seeing such a response towards the COVID-19?
It's not a fair comparison. It's a bit of an orange and an apple. Flu, yes, so far per year, flu has killed more people than this coronavirus, who has been around for a month and a half. But flu happens seasonally. Certain seasons and different parts of the world get those seasons at different times. But this is all happening at the same time. And because it's a new virus, none of us has met the virus before. None of us have any immunity. So imagine it spreads so fast, even if the serious cases only make up 15%, they say, all right? 15% of a large number, it's a significant number of patients. And that could put a lot of strain on the health facilities, our clinics and hospitals. So, and just like what happened in Wuhan, when it's overstretched, things can go wrong, mortality can go up. And despite what's happening with coronavirus, we still have other diseases to treat. Yeah. People still fall ill for all other reasons. So can it shock the system? Yes, and I think it has seen very clearly so far how it has affected the economy and things like that. What option do we have? Let it spread, let it go, and say, okay, it's going to be like flu. I think no government is able to do that